One of the things we pride ourselves on, whether it's a virtual consultation or in-person consultation, is really giving our patients a lot of information so that they can make an educated decision as to whether they want to proceed with something, either a surgical procedure or a non-surgical procedure. And so whether someone has a virtual consultation or an in-person consultation, they will have a patient care coordinator that will work with them, function somewhat as the quarterback of their care, and work with them from the very beginning, from the initial consultation, all the way through the process, so that they'll have that same person that they can call if they have additional questions. The average virtual consultation takes anywhere between maybe 15 and 30 minutes, depending what the individual wants. For example, if someone is wondering if they're a candidate for Botox, it may only be a 5-minute or 10-minute virtual consultation. If I'm seeing someone coming from a distance for rhinoplasty or maybe a facelift, that may be a longer consultation, 25, 30 minutes. So what we really try to do is just make it very, very, very safe and very easy for the potential patient who might be interested in something. Many patients will use the virtual consultation just to determine if they're a good candidate for something and what the doctor's potential plan might be. So rather than drive all the way here just to get a consultation with one of our specialists, they will have a virtual consultation with the doctor or provider to help them determine if they're a candidate in a plan, and then potentially schedule things in the future so that they can then make the trip into the facility. They will first meet with the patient care coordinator to kind of get to know them, and then they will meet with the doctor and the patient care coordinator together that will help them work through, determine if they're a candidate, go through what the procedure is, how long it takes, and they let them know step by step what's going to happen. We even have a packet that's specifically designed for each surgical procedure. We talk about those sorts of things. The next thing we talk about in the virtual consultation is, what is the recovery period like? Are they going to have some discomfort? Are they not? How long is that going to last? And their follow-up visits, because that's naturally very important to a patient, whether they're a local patient or they're someone coming from a distance. After they're done seeing the doctor, then they will again meet with the patient care coordinator, who will help them figure out the plan that the doctor talked about, including some of the financial things, what are the financial considerations, and determine what is really the best option for them. There is one advantage to the in-person consultation, and one of those is that we are able to get good photographs of a patient and do computerized imaging. And we do encourage computerized imaging. For example, if someone were having a rhinoplasty and wanted the shape of their nose change, we're able to give them a pretty good feel for what that image might look like. And that is one advantage to the in-person consultation, and not something we can do with the virtual consult. But many times when patients will have a virtual consult first and then eventually come to see the doctor once they know that they're a good candidate. So for an in-person consultation in the era of COVID-19, we've distanced the appointments in the office out. So there's no one really in the reception area. The patients are screened by phone to make sure they haven't been around anyone who's been ill, not running a fever, those sort of things. And then when they come, they'll be texted when they can come into the facility. They will be greeted at the door by one of our nurses. They will be offered hand sanitizers. If they don't have a mask of their own, we'll give them a mask, but we do ask patients to bring a mask in. Their temperature will be taken as well with a touchless thermometer, and they'll be brought into a room. They'll notice that the nurses are constantly wiping down the doorknobs, wiping down the surfaces in the room, and we are also distancing our staff. We're fortunate that we have a large enough facility that we can keep people distant. So all of this is done really to keep the safest environment possible for someone who's thinking about an in-person consultation. Each patient is taken care of individually. From the consultation right through to the surgical procedure, we kind of customize our care really to take care of that individual. There's a lot of contact and communication to make it very easy and very safe for the patients so that they don't have a lot of concerns, because what we find is that actually translates into better care, and not only better outcomes and better care, but patients feel so much better about the experience and the comfort of knowing that someone's there caring for them.